throat.
This is strep throat. So there is no immunization. And you don't want to ever stop antibiotics just when the symptoms get better, because then you can end up with bacterial resistance. And then, yeah, so that's why. So does anyone know what the condition is that you can end up with if you don't take antibiotics and you have strep throat? What's a possible consequence if not?
Is it MRSA?
No.
No.
It's not MRSA. It's actually something called, now my brain's going to have a, so it causes valve disease. Oh my goodness. I asked you and then the word left my brain. I'm going to tell you really quick. So it causes endocarditis in your heart. Like the bacteria can loop onto the valves of your heart. I don't know why I have forgotten the name of it. Rheumatic fever. So untreated strep throat can cause rheumatic fever. So there you go. Here we go. And then someone just joined us. So if you want to join, the pin is down there at the bottom, or I can tell you separately. Okay, which congenital cardiac defects cause increased pulmonary blood flow? ASD, VSD, and a PDA, tetralogy of Fallot, aortic stenosis, pulmonary stenosis, coarctation of the aorta, pulmonary stenosis, VSD, aortic stenosis, and tricuspid atresia. Okay, so this is one that you do need to remember, that you need to know. So we generally divide cardiac defects into whether or not they cause too much pulmonary blood flow or not enough systemic blood flow. So these three, ASD, VSD, and PDA, these are all holes. So ASD is atrial septal defect. It's the hole in the top two chambers of your heart. VSD is a ventricular septal defect. It's the hole in the bottom two chambers of the heart. And a PDA is a patent ductus arteriosus. So the pulmonary artery and the aorta cross over like this, and there's a connection between those two, and that's called the ductus arteriosus. So if that remains open, that's called a PDA. So all of those, they shunt from what's called left to right. So sometimes that'll be asked also. So I would definitely remember, just in your career for your future test taking knowledge, that these three defects cause increased pulmonary blood flow and they're a left to right shunt. So a child swallows frequently after a tonsillectomy and adenoidectomy. What might this indicate? Potential vomiting, pain at the incision area, bleeding from the surgical site, or sore throat from postnasal drip. Yeah, so this one is bleeding from the surgical site. So that's one of the things that you worry about after they've had a TNA. So this is, if you're ever like given a priority question about monitoring a patient that post-op TNA and they're swallowing frequently, this is going to be your priority, because they could be bleeding and that could be a medical emergency. So what should the nurse explain to the parent of a child with exercise-induced asthma with regards to cromolyn? Take before exercise to prevent asthma attacks, take at the onset of an attack, take as needed up to 4 times a day, or take during an attack to relieve symptoms. So this is one that, specifically is used more for exercise-induced asthma. So that's why that one is right. In terms of, so that's the best answer. Generally speaking, most of the asthma questions you'll be asked about are going to be albuterol. So what are some things that you can tell me about albuterol? Well, no. Yeah. What are some things you can tell me about albuterol? When do you take albuterol? What are some teaching points that you need to give people when they're using albuterol?
Shake well before use.
Shake well before use. What's specific about kids? You know, sometimes kids have like something extra that they use when they take an albuterol inhaler to help them get the medication.
Inhaler.
Yeah, it's called a meter dose inhaler, but sometimes they have what's called a spacer. So they'll put the MDI up to the spacer and the medication goes into the spacer and then they inhale it from the spacer. And so if you have so they lose less of the medication. So if you have somebody who's taking their fast acting inhaler frequently and they're not getting results, one of the things you need to make sure as a nurse is that they're taking it correctly. So with a kid, you would always want to make sure that they're using a spacer because it helps them inhale the medication. So the parents of a 3-month-old with cystic fibrosis want to know how their child got this disease because neither parent has CF. So only one parent carries the CF gene. The inheritance pattern is multifactorial, or both parents are carriers, or the result is probably a genetic mutation. So, right. So there's something called autosomal recessive genetic disorders, and CF is one of them. So if you have an autosomal recessive, you have to receive the gene from both parents. So if you only have one copy of the gene, then you're a carrier and you might not know it. So if you have cystic fibrosis, you 100% you inherited the gene from both of your parents. But if neither one of them knew it, then they're both carriers. If they knew it, you know, if they had CF, then they would know that they could pass it on. Which fluids are most appropriate for a 5-year-old child with asthma experiencing dyspnea and fluid loss? Carbonated beverages, iced fruit juice, room temperature water, or cold milk? Yeah, so good job. Room temperature water. You don't want anything really cold that might make them cough. Carbonated beverages also might make them cough. So you want just like room temperature water is the best choice. Why are patients who use dry powder inhalers for treatment of asthma instructed to rinse the mouthpiece? To prevent discoloration of their tooth enamel, to prevent candidiasis, to protect against irritation of their oral membranes, or to prevent halitosis? So good job. So this one is to prevent candidiasis. This is another word for thrush. So you want them to do that so they don't end up getting thrush in their mouth. How long after smoke inhalation injury are patients at greatest risk for pulmonary edema? This is like a smoke from a house fire or something like that. So 72 hours, 4 hours, 18 hours, or 2 hours. So yeah, 72 hours. And this is something in general, when you're talking about inflammation, you know, that peak injury time is within 72 hours. This brain injury, lung injury, inflammation sometimes takes a while. So which initial intervention will the nurse suggest to the parents of a child experiencing a barky cough? Bring the child directly to the emergency department, take the child outside in the cool air, use a humidifier or take the child into a steamy bathroom, or have the child drink plenty of fluids? So good. What do you think? What is barky cough? Which pediatric diagnosis goes with barky cough? Does anyone know?
No.
Croup.
No.
Okay, so if you ever see a question in your lifetime about a barky cough, you got to think about croup, which is going to be an upper airway problem. And so you do warm steam or a humidifier, kind of helps smooth that inflammation in their throat. All right, James, you're still ahead. What findings are expected when measuring the blood pressure on all four extremities of a child with coarctation of the aorta? Blood pressure lower in the arms than in the legs, blood pressure higher on the left side, blood pressure higher on the right side, or blood pressure lower in the legs than in the arms? Good. So coarctation of the aorta is the biggest artery in the body. It comes off the left side of the heart. And so the coarctation is narrowing. So it narrows after it's delivered blood to the upper part of the body. So the lower extremities tend to have lower blood pressure. So you frequently have to do 4-point blood pressure on kids if you're worried that they might have an undiagnosed coarctation of the aorta. Why do children with tetralogy of Fallot favor a squatting position? It decreases arterial blood flow away from the heart. It's a common resting position when a child is tachycardic. It increases the venous blood return, or it increases the workload of the heart. I'm sorry. So it increases the blood return back to the heart. So tetralogy of Fallot is one of those cardiac defects where they don't have enough pulmonary blood flow. So when they go into a squatting position, it pushes blood back to the heart, and then it can go from the heart to the lungs. So when you're studying for your HESI, your NCLEX, you definitely need to know tetralogy of Fallot. This is a cardiac defect that gets tested a lot, and this squatting question is also tested a lot. So I would definitely remember this, that this helps them get blood flow back to the heart so then it can go to their lungs. Which comment by the parent of a 1-month-old infant would concern the nurse about a possible congenital heart defect? He sleeps all the time, he tires out during feedings, he's fussy for several hours a day, or he's always hungry. He tires out during feedings. Very good. So, sweating during feedings, tires out during feedings. These are things that are associated with having a heart defect. Through what does the infant with hypoplastic left heart syndrome acquire oxygenated blood? Except a hole? An ASD, the patent ductus arteriosus, the VSD, or because the foramen ovale closes? Okay, so this patent ductus arteriosus, that's that communication between the aorta and the pulmonary artery. So sometimes patients have what they call a ductal dependent lesion, and that means they need that hole between the aorta and the pulmonary artery to get oxygenated blood. And hypoplastic left heart syndrome is in that category of defects. A child recovering from rheumatic fever needs to receive monthly injections for 5 years of what medication? Prednisone, penicillin, Benadryl, or Zosyn? So it's the penicillin. This is the rheumatic fever, is like the complication of untreated strep throat. So if they actually have rheumatic fever, they need to take penicillin for 5 years to prevent them from having complications. The nurse should prepare for emergency intubation when caring for a child with what diagnosis? Asthma, bronchiolitis, epiglottitis, or Kawasaki's disease? So epiglottitis, this is another thing that you absolutely have to remember. So you will see this question on your HESI, you will see it on your NCLEX, you'll probably see it on your exam 3. This diagnosis is a medical emergency. It's inflammation right of the larynx or the voice box. So kids that have epiglottitis, they tripod posture, so they lean forward when they're breathing, they drool, and they're not able to phonate. They're not able to make any noise because it's so tight in their airway. So 100% 100%, you have to remember that this diagnosis is always a medical emergency. It's usually bacterial, so they'll present with very high fevers and severe respiratory distress. How do you treat primary hypertension in a child? Encourage moderate activity, give prescribed Lasix at bedtime, encourage a high salt diet, or refer to an endocrinologist. So yeah, you're going to encourage moderate activity. Primary hypertension, they have hypertension because they're probably overweight and they're not exercising enough. So secondary, if they had like an endocrine problem that was causing them to have hypertension, refer to an endocrinologist would be appropriate. But if you just have a child that has an unhealthy lifestyle that leads to hypertension, the first thing you would do is improve their diet and encourage activity. An infant with a heart murmur and failure to thrive will likely have what diagnostic test first? An electrocephalogram, a cardiac catheterization, electrocardiogram, or an echocardiography? Good. So they're probably going to do an echo. And you do need to know the different tests that you would potentially do when working up somebody for a heart defect. Okay, last question, guys. What is the difference between HDL and LDL? That's high density lipoprotein and low density lipoprotein. HDL reduces risk of plaque buildup. LDL increases the risk. They're the same thing. HDL is a protein. LDL is a lipid. HDL is higher in cholesterol than LDL. Right. So these are the two types of cholesterol. So HDL is the good cholesterol and it helps actually prevent plaque buildup. So you will see questions about the difference between HDL and LDL again in your future. So good job. So James left early and he still made the podium. All right. So you do have a quiz next week. Definitely look at your chapters. I will send out PowerPoints today for the 2 chapters that were part of this week. And then I would also make sure you look at the Kahoot that we just did. Will help you with the quiz next week. And then I should post your grades this weekend. If anyone has any questions, you can let me know. Does anyone have any questions right now before we end class?
Yes.
Yeah.
On the test, it said something about the traction. It was associated with the femur, in which I know Brian's traction is used, but there's also a sentence in the book that talks about it also being used, Buck's traction, for femurs. So I just wanted to know if that was applicable to the second statement in the book where it talked about Buck's traction also being used for femur fractures as well at some point.
I think it's just a difference in the age group.
Okay.
Okay. Yeah, go ahead.
I selected Bucks because I knew that there was a statement that said that you're able to do that as well. Like you said, particular to whatever else. But also there's a question talking about otitis media and acute otitis media. Now in the book, the title is acute otitis media, and then underneath that it breaks down the word and just says otitis media, being descriptive of what that word means.
Okay.
So that was kind of confusing for me. And in the answer, I chose acute otitis media, but that's because that's exactly what
the book said.
Right.
Okay. Well, I'm happy to look at your questions and make sure, everything was fine. So acute otitis media versus otitis media acute would just be like a sudden onset. So, there's not really any difference between, acute otitis media and otitis media, other than that the acute just kind of refers to like you developed it suddenly. So, but, I will, we look at the test questions as a group. So if there's any
Mhm.
issue, I'll get back to you, and you're welcome to make an appointment with me if you want to go over any of the test questions.
Okay, yeah, that was it. It was just a little confusing for me, but I do remember seeing both. So
Oh, okay. Yeah. Yeah.
I chose
Are
the
there any
best
other?
answer, I think.
Oh, okay, good. Does anyone else have any questions? Okay, so you guys have a good weekend and look for your grades probably on Saturday, okay?
Have a good one.
You too. Bye bye.